Hello there, it's Dr. Jim Collins and my loyal dog Buddy, who's taking a nap right now during the video. So that always adds a lot to the frame that you're looking at. We have an article here for you. It's distance learning and for healthcare professionals. That's the title of the video, and then of course there's an article associated with this. But I just wanted to do a brief introduction to distance learning for healthcare professionals. Why is it important? Because we're busy. Healthcare professionals are very, very busy. They are required to take a number of mandatory compliance requirements. If they work in a dedicated memory care unit, which is an Alzheimer's unit, they have to take even more hours of training and education every single year. And of course, if you're a licensed healthcare professional, add all of your CEUs on top of that. That's a lot of hours. It's a lot of hours of training. So distance learning, though, is a great way to manage your time and get all of these requirements covered. Luckily, we live in the 21st century where you can watch me deliver information on a phone or a tablet or your computer, right? So getting on board is an issue, okay, that we have to talk about. Not every healthcare company in the country has turned to online learning. They're still doing it the old-fashioned way. But distance learning is becoming more popular. It is now known to be very effective, just as effective as live in-service training. It tends to be more budget-friendly, though, I could tell you that. I think distance learning is much more inexpensive. So the amount of topics that are out there in distance learning is very, very impressive. So you can find topics on clinical care, mental and behavioral health topics, substance abuse, leadership, and all sorts of trending topics like medical marijuana, for instance, or human trafficking. And the nice thing about distance learning is it can be done anywhere, anytime, as long as you have internet access. So it tends to be very convenient. But let's talk about some of the goals. What are some of the goals of online learning? Well, employees should be satisfied with it. Employee satisfaction does matter, because if they're not satisfied with the software or the program that they're using or that your company has purchased, guess what? They're not going to use it. So you're wasting money. Employee learning outcomes, very important. Is the education motivating them to be better? Are they actually acquiring new skills? Employee performance improvement. Are they doing their job better? Do their actions and their behaviors improve after spending this time taking distance learning courses? And then last, but certainly nowhere least, is resident, client, or patient health outcomes. Is the care improving? Is the quality of clinical care increasing? That's important. So some healthcare companies rely on traditional in-person training, and others have taken that leap, and I'm glad that they have. And they're using online or distance learning. How does administration decide which road to go down? Well, if this is important to you, you need to think about a few things. First of all, understand the needs of your employees. Is it much better for them to learn anywhere, anytime, using the internet? Or would you rather gather 100 employees into a hot room once a month and pay them for 2 hours and travel, and they have to find babysitters and all these other things? Look at how much you're spending. Do an analysis, a comparative analysis between what you're spending live for live training and then what you're spending or could be spending doing online learning. I'm here to tell you that I know online learning is less expensive. And in terms of it being effective, do your own research. I have found that in-person and distance learning are equally as effective. Distance learning may be even more effective. So weigh out these differences and then make your decision. So hopefully you will be happy with the decision that you make about your type of learning, either in-house or distance learning. And then I hope that you're happy with the results. And if you're not, there's always things that you can do about it. So I'm Dr. Jim Collins, and I will be talking to you soon. Take care.